Dr. Josh Beaudry here again from Life Springs Family Chiropractic. This one we're going to be talking about is another stretch. Now this is going to help with that sciatica, that hip issue, as well as the low back pain. So what we're going to be talking about is the hip flexors. These are things such as the iliopsoas, the psoas, or not the psoas, the quadratus lumborum, I mean. Now, what these are the muscles that attach between your pelvis and your back. Now, when you are in a stress response, what happens is you'll have specific muscle spasm. These muscles will be your hip flexors to pull you forward, as well as your hamstrings to pull your legs back. That's because we're getting in that defense posture. Other ones that happen are the shoulders. These are all subconscious stress responses. So this muscle group right here in the front will get you pulled over. So the more you're leaning forward, the more stressed you are. And we see this as we age, is that people have been in stress for so long, they actually structurally get stuck like this. And some people call it the Dowager's hump, or they're stuck leaning forward. That's why a lot of patients, when they get their brain to relax, will actually stand up straight and they say they get taller. So once back, those hip flexor muscles are the ones causing the issues. So what we need to do is stretch them out. So an easy way to do this is find a chair, a bed, a table, some sort of apparatus. And what we want to do is we want to keep our pelvis straight, and then we want to lean forward. And what we're trying to do is stretch this part right here. So we want our knee back, lean forward, and stand up. Now what you're going to do is you're going to feel stretching right here between the knee and the hip. What this is going to do is help those hip flexors to relax. Now once again, we're going to be doing this leaning forward. We want to do this for between a 15 to 30 second interval. So we're going to hold it for 1, 2, 15, 30 seconds, and then relax. Then we go forward and do it again, 15 to 30 seconds, and forward one more time. And you can see I'm bending down, and that's going to help it. We don't want our pelvis to tip either way. We're going to lean forward. That's going to allow that to stretch out. And we obviously want to do them both sides. Any stretch or exercise I teach you, you want to do it on both sides if needed. Now with this, again, if this problem subsides, good. If it keeps coming back because our brain is in stress and these muscles such as the hip flexors and the hamstrings get weak, that tells me I have a bigger problem. Should come in for a full assessment today, and it is free at our cost.